service capacity and capabilities for rural and underserved communities, support career advancement opportunities and for behavioral health providers through education and training, and also to increase the behavioral health system's capacity to provide culturally responsive care that is deeply embedded in equity-centered cultural responsiveness, the stigmatization of services, promotion of restorative healing, and community empowerment. Next slide. So eligibility for this RFGA. For RFGA. So the following entities are eligible to apply. First, entities that have a certificate of approval, entities that offer medication-assisted treatment services, the entities that have that are contracted with Oregon Youth Authority, entities that are certified opioid treatment programs, then entities that provide withdrawal management services. Next. Also, all eligible entities must operate an outpatient or residential facility that provide team-based care to individuals with acute behavioral health needs and provides behavioral health care to adults or youth, of which at least 50% are uninsured or enrolled in 50% that are enrolled in the state's Medical Assistance Program, the OHP, or Medicare. Next. So to qualify as a team-based high acuity Medicaid provider, a behavioral health provider must meet one of the following OHA, one of the following. So OHA anticipates issuing more detailed guidance in November. So first, must be a community mental health program offering one or more of the following: assertive community treatment, early assessment and support alliance, intensive in-home behavioral health treatment. Or B, must meet any combination of the following, at least two of the following: or the certificate of approval from OHA, derive at least 50% of annual behavioral health revenue from services to OHP members and Medicare, then provide integrated team-based care that includes any combination of on-staff psychiatric provider, integrated peer support, care management services, individual family group, and community-based services as clinically indicated. Next.
I'm sorry, Olufemi, I'm just going to jump in 1 second. Can we go back to that previous slide? Yeah, so
Okay.
I just wanted to indicate that I think our parentheses of at least two is actually meant to be on that third bullet point. So provide integrated team-based care that includes any combination of, and that means at least two of the following. So I just wanted to clarify that. Apologies for that parentheses statement there where it should have been in that third bullet. So, all right.
Hey, Tim, can I add something here, please?
Sure.
This is Larry with the Office of Contracts and Procurement. Just want to make sure that everybody understands that the presentation today may have discrepancies or questions in it that are not legally binding per the RFP until it's posted in Oregon Buys. And as Tim just well noted, what is posted in Oregon Buys is one or more of the following criteria. So if there's any discrepancies between this presentation and the Oregon bias posting, the Oregon bias posting will apply. Thank you.
Thank you. Next slide. So eligible recipients of funds include certified drug and alcohol counselor, certified gambling addiction counselor, licensed art therapist, licensed clinical social worker, licensed marriage and family therapist, licensed professional counselor, licensed psychologist, qualified mental health associate, qualified mental health professional, speech pathologist, peers, psychiatric nurse practitioner, or certified gambling addiction counselor, certified prevention specialist. Also included in this are certified recovery mentor, certified gambling recovery mentor, birth doula, community health worker, personal health navigator, peer support specialist, peer wellness specialist, other credential types that are not listed, but also provide direct behavioral health care services using their credentials and they require clinical supervision to obtain credentials. Then staff who do not currently provide direct behavioral health care services may qualify for educational incentives if the incentives support them in obtaining certification or licensure to provide direct behavioral health care services. So use of fund. Funds may be used to provide the following incentives to increase the recruitment and the retention of behavioral health care providers as at the entity. So scholarships for undergraduate and graduate students going into behavioral health care field. Loan forgiveness and repayment incentives. Tuition assistance and stipends for students enrolled in graduate behavioral healthcare educational programs. Next. So funds, use of funds continued. Grant funds may be used for the following allowable activities and expenses. 1, educational incentives for eligible behavioral health providers, including scholarship for undergraduate or graduate level education, tuition assistance for degree completion or credential advancement, stipends for students enrolled in behavioral health graduate programs, then loans repayment or forgiveness in exchange for a service commitment, academic materials directly related to the provider's program of study. For example, those require books, testing fees, licensure, application costs. Up to 12% of administrative staffing are needed to manage and implement the incentive programs. So grant funds may not be used for the following: services or activities unrelated to behavioral health education, training, or credentialing. Salaries or wages for non-administrative staff not directly involved in grant implementation. Then capital expenses, including construction or renovation of facilities. Indirect costs exceeding the 12% administrative cap. Incentives or payment for non-licensed and credentialed staff without a clear pathway to certification or licensure in behavioral health. The reimbursement for expenses incurred prior to the grant award dates. Next. So potential tax liability of grant incentives. All eligible incentives provided through this grant may be considered taxable income for the person receiving them. This means the individual might owe taxes on these funds. Awarded entities should check with a tax professional to understand any potential impact before giving out incentives fund, and should clearly explain any possible tax implications to providers before awards are made. OHA is not responsible in providing tax advice or determining tax obligations. Next. So reporting. Recipients organizations must report in a manner determined by OHA. The licensure, certification, or position type of each behavioral healthcare provider who received an incentive. The amount of grants, money spent per behavioral health care provider, the entity's staffing vacancy rate prior to and after receiving the grant. Then quarterly mid-project and closeout reports are required. Additional reporting may be required based on the specific workforce, incentives awarded and utilized by participating entities. Note, in prescribing the form and manner of the report described in this subsection, the authority shall seek to minimize the administrative burden imposed on the entities to the extent practicable. So the application timeline, the schedules here are tentative and may be subject to change. So the first one here was supposed to happen yesterday. This was completed. RFGA solicitation and the application materials was posted on Oregon by as at yesterday. Then on the 3rd of December, we expect that that will be the application deadline. All applications must have been submitted by 11:59 p.m. PST. Then between December 17 to December 26, we start to review the application and evaluation period by grant review committee. Then by 29th of December, we start issuing notice of awards posted to Oregon BICE and emailed to all applicants. Then by 2nd of February 2026, the anticipated project start date and initial distribution of funds. As I mentioned earlier, all these are subject to change. Next slide. So application scoring priorities. So priority for funding will be given to entities delivering services to the following service area and populations: child, youth, and family. This includes school-based, adolescent, and early childhood. Then individuals involved in criminal justice system. The organizations that operate mobile crisis intervention or mobile response. The rural and frontier communities. Those priority points will be automatically assigned based on the location of the rural health or zip code based primary care service area designations. the organizations that provide office-based medication-assisted treatment. Priorities for funding will also be given to entities that prioritize eligible educational incentives for the following providers. First, providers from communities who are underserved. The providers who deliver culturally and linguistically specific behavioral health services. The essay evaluation. So applicants will respond to a two-part narrative essay aligned with the application and scoring criteria. Applications will be evaluated based on the clarity, feasibility, and alignment of proposed strategies with the goals of behavioral health workforce incentive programs. The part one of essay evaluation, incentive use and provider focus. So applicants must describe how they will use incentive funds to recruit and retain staff in the priority provider group selected in the application drop-down menu. Strong responses will address the following: implementation summary. So this is like outline how incentive will be implemented, including key steps, responsible parties, proposed service commitment duration for each incentive type, and the criteria for selecting recipients. Then provider types supported. Clearly identify eligible provider types. For example, the LPC, the licensed clinical social worker, QHMP, CADC, peer support specialist, etc. Number of providers to be supported. Reference the budget worksheet and they indicate the number of providers expected to be supported. Rationale for number of providers. So here, we expect that the applicant will explain how this number was determined, including workforce need, organizational capacity, and the anticipated impact on staffing challenges. Then cost effectiveness and return on investment, ROI. In this portion, we expect the applicant to describe how the incentives strike a balance between being cost effective and strong enough to recruit and retain behavioral health staff. Next. So part two, service expansion and equity. Applicants must explain how this effort will increase and expand service capacity, especially for underserved or rural communities. Strong responses will describe how incentives will address service gaps and they promote equity, especially among culturally and linguistically specific populations. Secondly, it will highlight strategies to expand services in underserved geographic regions or high-need populations. And thirdly, include evidence-based models where applicable and provide quantitative and qualitative data supporting community needs. So funding guidelines. The maximum award amount is based on the total number of staff employed by the organization. So we categorize this into three: small, medium organization, and large. For small, this should be greater than, small is greater than 75 employees, less than, greater than 75 employees, and that would be $150,000. The medium organization will be between 75 and 125, and that is $180,000. Then the large is greater than 126. This is pegged at $225,000. Organizations that are awarded may receive all the funds they requested, subject to negotiation. Next slide. Application submission and selection process. So upon the request for grant application, the RFGA, closing the single point of contact, SPC, will perform an initial administrative review of applications received by the submission deadline, which I mentioned before, for completeness. Those are determined to be complete those that are determined to be complete will move forward to the grant review committee for further review. Then B, the GRC will review each application independently and will excuse themselves from the review process if there is a conflict of interest for applications. All reviewers will sign a conflict of interest form. Then C, reviewers will document the review of each application using the criteria found in attachment B scoring rubric. Upon conclusion of individuals' review, the grant review committee will come together to discuss applications and finalize the justifications and the recommendations for grant awards. So to register for Oregon Buys, please visit the website listed below. Then the direct link to solicitation number is also given there. Yeah, all the websites are stated in that slide. Next. So Oregon Buys. So you're encouraged to register in Oregon Buys by clicking on supplier registration as demonstrated in the attached picture. If you experience technical issues, please call the help desk that is listed below, 855-800-5046. Please note that OHA cannot provide technical assistance with Oregon Buys. Thank you. Questions and answers.
Yeah, before we get started too, I just want to say that we want to make sure that any of the questions that we have today are specifically about the RFGA that we're talking about today, and not about other things happening with OHA or in the state. So we just want to keep it focused on the purpose of today. So with that, I will leave us to the Q&A section of this presentation.
Tim, I would like to make a comment. I noticed earlier, I think on slide number 10, it talked about the closing date and time, December 3rd, 2025 at 11:59 p.m. And I believe that needs to be corrected. The Oregon Vice posting is actually 3 p.m. on December 3rd. So just to let everybody know that clarification's out there on the internet.
Awesome. Thank you, Larry. All right. Angela, I will have you go since I see you have your hand up.
Well, and I was throwing a couple things in the chat for Kaylani, and he may have responded to me. The question was just, what if you are part of a big agency that has multiple different programs across multiple different counties? And so I work for Best Care. Would Best Care as a whole be submitting one application? Or we're the CMHP in Crook County. We're the CMHP in Jefferson County. We have detox programs in Klamath and Deschutes County. Um, all of those programs have very different needs, and different demographics that are being served and different kind of holes in the workforce. And so to submit one application as a whole, I feel like would be missing sort of the more intricate pieces of the various programs.
Yeah. So is your question,
So my
um,
question is, do we have to do one application as a company, or can the various programs within the company each do their own?
yeah, if it's representing different counties, then I think that totally makes sense within that aspect. So especially when it comes to CMHPs, that definitely makes sense.
Okay, great. Thank you.
All right. Uh, Finn, is that your name? Finn? Great.
Hi, yeah, it's Fen, like Pen. Um, yeah, thank you for hosting this Q&A. Quick question just to verify my understanding. In an early slide, it looked like there was a stipulation that the eligible agencies need to run an outpatient facility. Is that correct?
Sorry, I was trying to get off mute here. It can be so it's outpatient or residential.
Outpatient or residential. Okay,
Yeah.
so if we, my agency is very small, but we do have an in-person drop-in center for our peers, and therapists do run sessions out of that drop-in center. Would that be a qualifying facility?
Yeah, so it sounds like you've got I think it does sound like that. I'm so sorry. Can you just repeat that situation for me one more time?
Yeah, so we have a drop-in center that peers can use as a sort of peer drop-in,
Hmm.
so just to spend time. And then also therapists run sessions out of that drop-in center.
Yeah, under our eligibility, it looks like that in that situation you would qualify.
Excellent. Okay. Thank you very much.
No problem. Okay. Brett, are you here?
Yes, I'm here.
Okay. I will hand it over to my colleague Brett to continue this. I have to head out for just a short call and I will be back, folks, but I will hand it off to Brett. Thank you.
Yeah, thanks, Tim. And I know we're working through a lot of questions in the chat as well, so just bear with us as we try and keep up. I know there's a lot of questions pertaining to this grant opportunity, but so unfortunately, I don't know who raised their hand first. I'm just going to go with what I see in order here. So go ahead, Stacy.
Hi, thank you. I work for the Portland DBT Institute, and I'm trying to determine if we would be eligible to apply.
Okay.
We're a for-profit freestanding clinic, and we run training for people in the community. We do have students that co-lead with us. But I'm just wondering if there would be approval for a funding stream where we would have a dedicated pool of money to provide scholarships for folks wanting to train with us, which could be grad students, those anticipating going to grad school, folks from existing community agencies that, have a workforce interested in, improving their understanding, comfort level, skillfulness of working with high risk clients.
Yeah, absolutely. So if you were to apply for this RFGA, one thing that you'll see in the application is it'll ask you what type of incentives you intend to utilize if awarded. So if you want to focus all of your funding, if you are awarded to scholarships, that's something you can do. We will have stipulations around that though. Like one thing that we're requiring is that um, employers have a service commitment type of obligation or contract with your employees. Um, to keep them on for a certain amount of time. And that's just to help with retention efforts and ensuring that folks like follow through with if they are receiving scholarships. The intention is that they will gain a credential or an education that will help them to either be able to provide behavioral health services or expand their ability to provide behavioral health services at your site.
Okay, and so if we wanted, though, if we're not focused on retention of our own staff, but wanting to be a partner to folks that are needing the training, um, that's where I'm kind of getting
Mhm.
um stuck in trying to wrap my head around, because I don't, in terms of like the training, just being a partner for folks that are looking for training for people so that helps other people with retention of their staff and proper training of their staff.
Yeah, I think that's okay, Stacy. Just make sure in your essay when you apply that you state that. I think it's something we can definitely evaluate and consider on a case by case situation. If you're able to just demonstrate in the application that even if retention might not be at your site, but it might be retaining behavioral health providers in other areas of the workforce, then that's something we can potentially consider for sure.
Okay, wonderful. Thank you so much. I appreciate it.
You bet. Okay, and moving still left to right here, I have Wendy.
Hi, thanks. I'm getting the impression that so we're a small nonprofit that employs peers, therapists, sud treatment folks,
Mhm.
that this is something that we could apply for to both, as you said, retain our existing staff and then also attract and skill up staff. Because we're also in the midst of doing a lot of hiring for our residential program. So it sounds like that it's not just to pay for scholarships and things like that, but to all kinds of attraction and retention strategies.
Yes, correct. So it will have to be held to the four incentives, and it's just because they're specifically outlined in the House Bill of 2024. And so the allowable incentives are scholarships, tuition, loan repayment, and graduate stipends for graduate students. So that's the one that has to be for graduate students. But we can utilize stipends in creative ways. Tuition assistance can fall under that. The ultimate goal, if you are training up any part of your workforce, is that again, it is leading to some sort of credential, certification, or licensure or degree that allows them to provide behavioral health services or expand their ability to provide behavioral health services. And so, what's great about that too is that you could have staff that might not be certified or licensed. And that's where we try and open up a grow your own model type of approach where maybe someone might not be delivering behavioral health services at your site right now, but with these incentives, it can get them into that type of position that can provide behavioral health services.
Okay, so I think so it may be more limiting than what I'm envisioning. So if, for example, we have staff who are licensed, but because of the salary they're making are considering exiting the field, this funding is not something that could be used to retain them.
Yeah, we these incentives cannot supplement salary. However, if your licensed workforce is interested and you can provide loan repayment to help with retention, that could be a big incentive for providers. But unfortunately, with how the bill is written, these incentives cannot be utilized to supplement wages.
For retention wages, wage
Correct.
supplement. Okay. All right. Thank you.
Sure thing. Okay, Zachary.
Yeah, this was addressed in the chat, but kind of looking for some clarification. So my organization, we have our COA over 50% Medicaid, et cetera. We have we use 1099 contractors in general, and it sounds like so far as using the funds for retention and recruitment, that part of the mechanism would have to be after the fund. I'm wondering if before the funds or awarding the funds to be used, I would have to say, hey, you're now an employee and you get a salary versus being a 1099? Or does it work to where after the service commitment, they would have to become a full-time employee? I'm trying to understand that distinction and designation a little bit.
Yeah, and in this situation, it is kind of hard. I mean, ultimately, the goal with these funds is to recruit and retain your behavioral health staff. So, if contractors are used as your behavioral health staff, I think that would be something that we would consider on a case-by-case situation. Primarily for these incentives, they are supposed to be for your full-time employees. However, if you are awarded and that is a significant part of your workforce, and we're able to show and document that providing incentives to your contracted workforce will help retain your ability to provide services to your community, then I think that's a discussion we can have, but it would be a
Okay.
case by case situation, and we would just talk through that in the contract administration process, and once we start working with you.
Okay, great. And then well, I guess that kind of covers it. And then also, it sounds like it's kind of more to the function of the grant too, so far as writing to these people are going from CSWAs to LCSWs, et cetera, and kind of using that as the terms or the benchmarks, just so far as this person would get loan forgiveness. They were a CSWA, they stayed with us until they're an LCSW. Um, that's kind of like what you guys are looking for.
Yeah, absolutely.
Okay.
The goal is to either retain your workforce. So you could have licensed providers that might not be skilling up, but through like loan repayment, they are staying on and they've signed like a 1 year or 2 year service obligation to stay with you. Then that also is achieving one of our major goals when it comes to our workforce crisis. So yes,
Excellent. Okay, great. Thank you very much. Appreciate it.
absolutely. All right, Chase.
Hey, yeah, thanks. You had answered a similar question earlier about, larger organizations. I think Angela actually asked this question about, multiple different programs and the recommendation, file different applications if they're across different counties. I guess more specifically, like if we have maybe three programs within one county, are we better off just advocating for all three programs in one application, or does it make a difference if we split those out as well?
Man, I mean, this is a really good question. It's something that maybe we didn't fully consider all the way through. And I think the thing that we need to be sensitive about with this solicitation is that we only have a finite amount of funds. And
Right.
so ultimately, the idea is we want to distribute out these funds to as many organizations as possible where, if you have all of your sites applying, it could pose a risk for the agency to award to one specific employer. So I think overall rule of thumb will be as an agency and as an organization, no matter how many practice sites, to apply as one singular entity. And then, and I hate saying this because I ultimately what I'm trying to say is that I wish we had more funds.
Oh,
That's
yeah.
advocated for in the legislative cycle and all that kind of stuff. So given the finite amount of funds, we would prefer for organizations to apply as a total entity. However, we want to hold space as well for some of the large organizations across county lines that completely, like Angela was saying, doing completely different types of things, have different scopes of work. So I would say at this point in time, the rule of thumb will be to apply as one agency
Yeah.
unless is that across agency and the scope of work is completely different or it's a larger organization.
Great. Yeah, because what I was anticipating is, to try to what is advocate for the full 225, one application, but we would allocate, how much approximate funds adding up to 225 we would put towards each program and why. I think is kind of the approach I was thinking.
Yeah, and I think that's how we have it in the essay. We ask, like, how do you intend to use these funds? Please describe over multiple sites, if applicable, things
Perfect.
like that. Um, I do want to hold space, though, and acknowledge that this is a finite amount of funds.
Right. Of course.
Yeah, and our intended goal with this is to provide a blueprint for the state to show that these incentive programs can be effective, and hopefully through that, we can continue on this program and have reoccurring funds. So our goal as a team is to have this program be a yearly, biannual type of application process where we can continue this. So we're really trying to lay the groundwork and be able to convey to the public how we recruit and retain behavioral health professionals through incentives and what's effective and what's not.
Great. Thank you.
Absolutely. Finn.
Yeah, so in our process of recruiting and retaining peer support specialists, I feel like we will probably encounter a number of peer support specialists who have degrees in things that are not related to mental health. And I'm wondering if those loan repayment funds can be used to pay back loans on things that are not related to this field.
Yes. So that's actually something we allowed with another loan repayment program that we opened up several years back, the behavioral health loan repayment program. We considered all type of educational loan debt. We know it can be really encumbersome for individuals, even though it might not fit exactly in behavioral health or social service education. They're here. We want to acknowledge that and we want to respect why they're here. And so if we're able to tackle any type of debt that we know so many Americans have, then all for it. So at that point in time, it is allowed, and it is up to entities that are awarded to make that decision. If you have a large workforce for whatever reason, you have to be a little bit more strict, kind of spread the money around, then by all means, you can go that way too. I think that's one thing we're trying to do as a program as well, as allow for as much flexibility and creativity as possible, given the parameters of the bill, while still allowing you guys to do your work. And then from there, we can understand maybe what is effective and what isn't. So yes,
Thank you.
you're welcome. Jennifer.
Hi, good afternoon. I opened up the application and in section 4 around minimum requirements, it is listing eligibility slightly different than what your slides have. And I'm
Okay.
just wondering, what are we to follow, the slides or what's in the application? And yeah, maybe you could clear that up.
Yeah, absolutely happy to do that. So actually, I'm right on the RFGA as well. So I will copy and paste the application requirements or the minimum application requirements for an entity, and we'll go through it real quick and
Okay.
clarify all that. And we will follow what's on the RFGA and not our slides. So if there are issues that or any errors that we have with our slides, we'll go with the RFGA. For some reason, I cannot send it, but I will go ahead and just read it out for everyone. So there's kind of two criteria. The first is that all entities must meet all of these items to be eligible. And so that would be operating either an outpatient or residential facility in Oregon, must provide team-based high acuity Medicaid provider. I'm sorry, be a team-based high acuity Medicaid provider. And we have that defined in the RFGA as well. Every entity must be serving SPMI or acute individuals with behavioral health needs. And then all entities must also provide behavioral health care to adults or youth, of which at least 50% are uninsured or enrolled in the state medical assistance program or Medicare. So that is uninsured, OHP, and Medicare. And then the second stage of that is okay. So if you hit all of those marks and you do all those things, then you must meet one of these criteria. You must have a COA. You must that could be one of them. You have your COA. You can also be eligible if you are one of Oregon's 9 federally recognized tribes, or NARA, which is Native American Rehabilitation Association, which is an urban Indian health program. You can also qualify by being a certified opioid treatment program or an organization that provides medicated assisted treatment or provides behavioral health care through a program that contracts with or is administered by Oregon Youth Authority. So that might be some of our juvenile type of centers and things like that. So it's 2 stages, must meet all of the first criteria, and then from there, you just have to meet one of the ones that I just listed. Did that answer your question, Jennifer?
It did, thank you. And you said the definition for the team-based care is in the RFP as well, right?
It is,
Yeah.
yes, it is in the
Okay.
RFGA, and I believe we have our definitions at the front of that document.
Great. Thanks.
Tim, I'd
Absolutely.
like to just reiterate again that any discrepancies with the slideshow versus the RFGA is what we're going to be going by. So in cases like you just addressed, we need to refer to the RFGA only. And if there's any changes, amendments, questions and answers will be all posted to Oregon Bias for everybody to keep track of. And that will be the guiding document that we will use for the RFGA. In addition, any communications or questions need to be submitted to myself. My email address is on the first page, and only to myself. If any conversations or questions happen outside of that, you could be disqualified. So just want to set that stage as well. And if you have any questions about that, just please reach out to me. I'm happy to help.
Yeah, thanks for that, Larry. All questions related to the RFGA outside of this meeting will be directed to Larry, but we help him in that process as well. So go ahead, Angela.
Yeah, thanks. I have just kind of a follow-up to the earlier question that I asked. So as the CMHP, so I'm the director for the CMHP in Crook County, and I have approximately 60 staff members out there. Best Care as a whole has like 350 staff members. So if the Crook County CMHP submits its own application separate from, let's say, Best Care as a whole, would I be would my site would be considered that like 60 people, not the in terms of the amount that would be awarded, right? That's what I'm trying to figure out. Is that correct?
Yes, that's correct. So however you decide to apply, what we ask in the application is how you intend to use the funds for the sites you want to provide those incentives to. So if you do have one site in particular you want to focus these incentives towards, then we would recommend that you apply just for that site. However, if you have multiple sites that you want to spread these dollars around, then we would recommend that you apply as Best Care.
Okay, perfect. Thank you.
Absolutely. Any other questions? Yeah, Shannon.
Hi, thanks. So we're designing this program for, let's say, scholarships, tuition reimbursement, things like that.
Mm-hmm.
But we don't know at the time who's going to take advantage of those things. And so I'm thinking about how this program would work. Like we apply, we're given some award, but we kind of don't know ahead of time how many people will A, be able to take us up on that reward, and B, who will complete it.
Mm-hmm. Mm-hmm.
Are there any thoughts or guidelines around that, like how we might think about that?
Yeah, so I will say that you are not beholden to specific incentives that you mark on your application and you're awarded. We recognize that you might not know exactly what your workforce wants when it comes to incentives. And so we've had it in the past plenty of times where an agency is doing loan repayment, but no one wants loan repayment. So all that is just reaching out once we are contracted to talk to the individual that will be the contract administrator for that and talk about like where you're seeing the issues are, and then potentially retooling, and then that would be an amendment to the contract. So if for whatever reason scholarships isn't working, but loan repayment is a big hit, we're all about flexibility. We want to make sure that whatever we can do in the guidelines of the RFGA, we would allow for you to be able to retool and shift funding over. It would be an amendment in that regard.
Okay. And so really the proposal is written about what programs and incentives we plan to offer. And
Yes.
as opposed to us going out and, surveying all the staff and going, hey, who wants to do this, and requesting specific things for specific people.
Correct. It's up to the discretion of the entity to determine what incentives are going to be effective. So we do want that at the front. We want a strong plan of action on how incentives will be distributed, the details, the specifics of it, how much funding will be given to each individual. We want to make sure that incentives are competitive with national and state incentive programs as well, just as a way to make sure that there's not something that could entice them somewhere else, or just wanting to make sure that the incentives are strong enough that they're actually effective. So that should be reflected on the essay. However, if there are changes and for whatever reason incentives are not as effective as previously planned for, that's something that, of course, we'd be always open to have a conversation. We want these dollars spent and them to be effective in recruitment and retention. And so midway through, if there's ways that we can do that, we're happy to explore those options.
Great, thank you.
Absolutely. And I know that Kalani is trying to answer as many questions as possible. Hopefully he's not getting carpal tunnel. Any questions that are not answered at this moment, we will follow up and make sure that we answer every question, and we will be posting it as a FAQ, which you'll be able to access on the website as well. So bear with us, and we will make sure that every question in the chat is answered. And then any other questions that we might not be able to answer today, we will also add to the FAQ and answer at that time. Yeah, Fen.
Hey, sorry, one more question. So I was just looking at Kalani's answer, and I'm wondering if these funds are able to be accessed by people who are half-time or part-time, or if there is a requirement that they be full-time employees.
They can be part-time employees as long as there is an intention and a service obligation and commitment from that employee to stay with you and to work with you on like all of these incentives will have some sort of service obligation. It's up to the entity to determine what might be effective. But we will want some sort of service obligation where in return for receiving incentives, they commit to continuing to work with your agency or your site or organization. So yes, absolutely. We definitely want to recognize all workers to the best of our ability that are providing great services. So absolutely. Veronica.
Thanks, Brett. I'm just following up on the question I put in the chat. So we literally just opened up our clinic in June, still finalizing our contracts with the two CCOs, and so we don't have historical data to show that our participants are going to be OHP members or uninsured, but that is our mission. So you had said that we could explain this in the essay section, but if we don't meet criteria, we aren't eligible. Is there do you know if there's going to be like a round two of funding a year from now that we could, like, if we have to sit this one out, we could be hopeful that there's going to be one in the future? Or should we still go ahead and apply and explain this and kind of show data from our broader organization and how our broader organization is serving this population in non-clinical services? And since we're taking mostly internal referrals, we would expect that our participants in the clinic would also have the same profile.
Thank you for the question, Veronica. It's definitely, it's hard. We want to try and have as many organizations be eligible to apply. Based on what you're telling me, it doesn't sound like you'd be eligible at this moment. I believe that's something that Tim answered in the chat as well. However, reach out to Larry, and we could maybe consider it as a case-by-case situation. Just send Larry an email and then outline, your reasoning, and we can try and answer it there. But I don't want to bring up your hopes, but it will be something that we would have to consider based on like just sidelining the conversation and determining from there. But I don't believe you would qualify for this round. However, the second part of that, yes, we really hope that this can continue, and we're hoping this can be a blueprint for a model that is effective for behavioral health organizations. So if you're not able to qualify this time around, we really are working hard to make sure that we're conveying successes and all of the progress and outcomes from these dollars so that we can get renewed for funding, whether it be from different sources or just from the state again, whatever it might be. We want to continue these incentive programs. All right. Tira, did I say that right? I apologize if I butchered that.
No problem. You got it right. Thanks.
Awesome.
Yeah, just logistically, I know we submit our response on a smart sheet form. And when I've looked at that link, I'm a little confused. I was wondering if there's a way you could just share with us now what we're looking at. And do we, are we supposed to, I see there's a place to upload the budget. And in that same thing, do we upload separate documents with our essay answers? Or I saw there was something about mentioning of drop-down menus and I didn't come across any of that. So I'm just curious if it's possible, maybe you could just share something about that. Sorry.
No, that's okay. And it's a good question. And let me just ask Larry real quick. Would it be helpful, and Larry, would this be okay if I just shared my screen for a minute to show the RFGA through Smartsheet and how that process looks?
Absolutely, because I'm confused too.
All right, then let's do it.
I
So
would
just
say this, though. I believe that they do have to register an Oregon buys. That basically allows us to pay them. And secondly, I believe you're wanting some information submitted through Oregon buys and the essay and other things through the smart sheet, correct?
correct. Yeah, and let me just share my screen now and we'll just go through all of it. Oh, actually, you know what? Is Kelly on the call? I believe Kelly might be presenting right now. Thank you, Kelly. All right, one second. Let me share my screen.
Yeah, while you're doing that, Brett. Hi everyone, I'm back. I just wanted to say that we want to make sure that the link is not shared like across people because we want to make sure that everybody's able to read the RFGA, that they're getting the link from the RFGA, that they're going to Oregon Buys and they're getting the information from there. Because it's very easy, obviously, to share just a link with someone. But in order for them to really get all the information, they really need to be coming to this page that Brett is sharing here so that they can have access to all the materials and all the information.
Yeah, thanks, Tim. And so this will be your landing page. Definitely still go through Oregon Buys. And you'll see here midway through the page, you'll see file attachments. So the first one being the RFGA. The second one are the essay questions. And so we pulled that out from the application just so you can see them before you actually apply because Smartsheet is really great, but you can't save your progress midway through an application. So we highly recommend that all folks that apply open up the essay question doc here, answer those questions there, and then just do a copy paste into Smartsheet once you're prepared to submit. There's also scoring rubrics, so that'll just give you an idea of how we as evaluators at OHA will be scoring these applications. And then you'll also see here the Smartsheet application link. So when you are ready to apply, you'll click this and it'll provide a link to Smartsheet. Also, real quick, there's the budget table as well. So we recommend not only completing the essays before opening up Smartsheet, but also to fill out your budget table as well, and then upload that once you're ready to actually apply. So once you click on this application link, it's just going to be Word doc with the link. You'll open that up and it'll lead you to the RFG application. A couple things just to get everyone's bearings. The first thing being that on the left, we kind of have our scope of work and our statement here. We do have some definitions. These are some of the definitions in the RFGA. They're not all of them. We pulled definitions that are most applicable to the application. We wanted to put all the definitions in here, but the text would just be too small. There's only so much room that we can fit over here. So like you'll see team-based high acuity Medicaid provider, the definition for that as you go along. So once you have your essays written out and your budget sheet drafted, then you'll go through here. The first thing being that you'll attest that you have read the RFGA. We have a notice requiring or strongly advising folks to do what I just said when it comes to filling out the essays and the budget worksheet first. And then you will upload your budget worksheet here. And so I need to actually do this real quick to actually move this along. I don't know if this is helpful. Is this all right if I just go through it all? Is that good with folks? Okay,
This is helpful to me. Thanks.
you bet. All right. So then you'll put the name of your organization. You'll indicate if you are an outpatient, a residential facility, or both. So in this instance, if you are an organization that has an outpatient and then also a separate residential facility, you'll indicate both or one or the other. Then this is one of the eligibility criterias. We need to make sure that you're one of these. So you'll select the type of organization that you are. So you can click more than one, but if you qualify under one of these, that is completely fine and it will progress you forward in the application. The next thing will be the primary street address of your organization. And so make sure that if you intend to put the address of where you intend to deliver your incentives to. If that's over multiple sites, list the site that will be receiving the majority of your incentives if you have multiple that will be receiving incentives when it comes to the dollar amount. And then you'll do just city, and then zip code. And then the next question is, does your organization have other locations? And so that's where you'll indicate if you intend to use incentive funds for other locations. So just for the sake of moving through this quickly, we'll say no here, but it would just ask the same questions about address, city, zip for that other location. The next question is asking the total size of your organization. So again, this will be the total number of employees across your entire organization, including all the practice sites that would be receiving incentives. Then we ask a question of where you provide in-person services and what counties. And so you'll just click all the counties that are applicable. Try and be specific here. It's helpful for data analysis and understanding every organization's reach. The next question is, does your organization provide behavioral health services who experience SPMI? So this is one of the qualifiers. So if you say no here, or if you do not qualify for this, it'll give you indicator that you will not qualify for the RFGA, and then you would back out at that point. But if you do provide SPMI services, which I know all of you on the call do, then you'll proceed forward with the next criteria. If you provide team-based high acuity Medicaid provider services. And so we also have the definition here as well that is helpful to see. And then you'll just go through and select yes. Then we also asked, just for our purposes, just asking what type of evidence-based care you provide. And so you can select all these, or if you have another model, then you can indicate that here. And we have a drop down asking what the other model of team-based evidence-based care that you provide. Next qualifier, do you provide services of which 50% are uninsured on OHP or on the Medicare system? And so you say yes here. Has your organization previously received grants from OHA? This is just for our purposes. Not a scoreable item, but we're just curious. And if you have, you can just mark that here and just briefly explain what that was for if you have received funds from OHA. Then you will enter the total amount of funding you are requesting. So if you indicate in your application that you are a small organization, your maximum amount of funds that you can request is $150,000. You can request less, or you can request up to the max. But please do not request more than what it indicates here for your organizational size. Zachary, I see you have a question. Is it related to this?
Yes, it is. I was curious when you talk about models of service, because I'm thinking about, kind of from a therapist perspective. Would that be kind of like therapeutic modalities? I'm thinking about, we have some people that work with kiddos who do play therapy, and then some people that work with adults who do ACT therapy. And if you would want us to kind of list all the stuff our clinic does, or, just kind of be more broad, or if you had any thoughts with that.
No, that's a good question. I think this question is more towards team-based type of care models. If you do want to put other models, by all means, it's not something we score on. However, if you can put that on your essay question, if you use specific type of therapeutic models that are proven to be successful in whatever area, then that could help aid in your application. So if you do want to indicate that in the successes with whatever models you use at your site, then put it on your essay versus just indicating it here. And I think that would be a little bit more helpful for us as evaluators as well.
Yeah, and for the well, I guess integrated behavioral health would also, you would qualify under that, but we would put other model as well, like just in general, because it looks like this is a required one, so I want to make sure that we would be answering that
Yeah, it
correctly.
is required. One thing that's a little wonky with Smartsheet is that if you click multiple evidence-based practices that you provide and you have other model, it doesn't ask for the other model. And the reason being for that is we don't want to complex, we don't want the application to be too complex, but it's something, if you have other models, just put it in your narrative essay, and it's something that we can also ask at a future date too if you are awarded. So this is more for data analysis on our end overall.
Okay, great.
Yep.
Thank you. Appreciate it.
Sure thing. Okay, and then so after you indicate the total amount of funds that you are requesting, then we'll ask you to indicate the incentives you plan to utilize, and you can collect all of them or one of them. And then this is where we're going to be getting baseline data about your total workforce. And so understanding what the vacancies are, that is something specific that the House bill has asked us to collect, is vacancy rates. So essentially what we're trying to do is show that through these incentives, vacancy rates are reduced at your organization because of these incentives. And so we'll be collecting a baseline here. If things change, as you apply, and then you have a different vacancy rate, after you're awarded, we'll just confirm if that's still the same, and we can update on our end as we go through this. But this is just kind of some baseline data that we can then use to convey to the public on successes. Then the next question will be the total number of behavioral health positions at your organization. So the first one being, what are the vacant behavioral health positions, and then what is the total number? And so that includes your staff that you have on right now, and then also includes your vacancies, which will give us the vacancy rate. And so there's guidelines there, but if you have any questions regarding these guidelines, just email Larry, and we can get that answered when it comes to specifics on answering the vacancy rates and just your total size of your organization. Okay, and so which behavioral health provider types will you incentivize using this funding? So this is a scoreable item. So what that means is that if you intend to utilize incentives to recruit and retain culturally and linguistically specific service providers, you will get points for that. However, one really big important thing here is that if you intend to use incentives for CLSS providers, for child, youth, and family service providers, you will get points for that, but you will get points deducted or removed if you do not explain that in your narrative essays. And so it's a little bit of show your work type of concept. And so there are service areas and service providers we want to prioritize for funding. But if you're not able to indicate how you actually do that with a model or a plan of action that actually will recruit or retain behavioral health providers that are CLSS, that are mobile crisis providers, child, youth, and family service providers, so on and so forth, then those points will not be awarded to you. Scott, I see you have a question.
Thank you. I'm a little slow on the draw, so I'm going back to the question about vacancies. And I'm wondering if an organization that is motivated not as much to address vacancies, but motivated to increase the average experience of its staff is still a good candidate for these grant funds?
Yeah, that's a great question, Scott. I appreciate you asking that because, yes, we are looking to try and fill gaps when it comes to vacancies. However, that's not the only thing that we want to prioritize when it comes to entities. And that is where it'll be really important for you, Scott, to indicate that in your narrative essays. And that can be a focus on retention. The other part of that, too, it's not just about filling vacancies because we also know that maybe some entities have a vacancy rate for a reason, right? No one wants to work for them. So that's part of it, right? We want to make sure that we have providers in areas of need that are able to provide services, but it can be either filling vacancies, it can be making sure that you have good team morale and that you're improving quality for your providers that are working for you. But then also the one big one that we want to see in applications is how does that then translate to expanding services to Oregonians, right? So if your team is you need to build that up from the ground and have team camaraderie and make it a more enjoyable place to work. We want to see how that then translates to providing better and more qualified services and quality services to Oregonians, and then also potentially expanding services as well. So all of those things can be good indicators of a good application.
Thanks, I appreciate it, Brett.
Yeah. And so I kind of, with Scott's question, that kind of goes exactly into these essay questions. So the first one being, this is more of the nuts and bolts regarding how you intend to deliver incentives. So it's more if you do loan repayment, how many providers are you going to be supporting with loan repayment? How many of those, like what's the total dollar amount that those providers will get for loan repayment? Things like that. And that should be supported also in your budget worksheet as well. So kind of that implementation summary, number of providers to be supported, the types of providers that are going to be supported, the rationale behind why you decided to give $10,000 to each provider, and then the cost effectiveness and return on investment. So essentially justifying the reason why you came up with this plan. So we think that $10,000 will be a significant retention for our licensed staff at our crisis team, just as an example, because of these things. It's competitive with national averages or something along those lines. Any type of evidence-based things where you can point to show your work is will be scored higher in that way as well. So that's the first question. The second question is, okay, so with these incentives, you gave us the outline of how you intend to implement. Then how will they increase or expand service capacity for the populations you serve? So addressing service gaps, indicating how this will promote equity, especially amongst CLSS providers or CLSS specific populations. Strategies that will be used to expand services to your community. And then this will also be a place where you can indicate evidence-based models where applicable to strengthen your argument. And then if you're able to provide any quantitative or qualitative data to support how you will expand services to community, then that is really helpful as well when it comes to us being able to score these applications. Okay. And then from there, that is the end of the application. So if you want for assurance, you can click this button and it'll give you a copy of your responses. They will be recorded. And you'll just click submit here and hopefully I filled out everything. If not, it will tell you where you need to fill out. So once that is done, then it'll be captured and then you're good to go. And so I know we talked a little bit about timeline at probably the beginning of the presentation, but the application posted yesterday. All entities have 30 days to apply. And so the deadline will be December 3rd at 3 p.m. And then at that point in time, it'll take us about 2 or 3 weeks to score, depending on the amount of volume that we get. But our goal after that 3-week period is over is to let entities know through Oregon Buys who was awarded. And then from there, we will begin the contracting process. And so our goal from that as well is to try and get those contracts executed as soon as possible at the start of next year, but it'll probably be somewhere around February, March before those contracts are actually executed. It's just a timely process. But yeah, that's kind of where we're at. So I hope that was helpful. And I know we're getting still a lot of volume in the chat, so really appreciate our team and Kalani answering those questions as they come up. How about this? I know that we're approaching time. For those that got the information they needed, please feel free to jump off. Our team will stick on for a little bit and answer any questions. Otherwise, if you do have questions you don't want to ask them here, you can reach out to Larry Briggs over at OCMP and we'll make sure that those questions will be answered. And just as a reminder, we'll also be posting our FAQs. So any questions in the chat will be addressed in the FAQ and we will post on the HB 2024 website.
Hey, Brett, there's a question just popped up. To clarify, nothing is submitted through Oregon Buy's website. All is submitted through the Smart Sheet. Can I answer that?
That is correct. So all the materials are provided on Oregon Buys, but then you're going to take the budget worksheet. Ideally, you're going to want to fill out your essay questions on a Word document. And then once you are done with those two items, then you'll go into Smartsheet, you'll fill out everything, and then you'll just do a copy paste of your essays into that space provided for the essay questions, along with attaching your budget worksheet. So yes, all of the information will be submitted through Smartsheet.
Thank you.
Absolutely. All right. Well, really appreciate everyone hopping on and joining us. I'm really glad to see so much interest in this RFGA and this solicitation. So really appreciate everyone's time. Thank you for being here. Thank you all for the incredible services you do for Oregonians every day. So really appreciate that. So thanks, everyone. Enjoy the rest of your day. We'll hold on just for another 5 minutes if there's any lingering questions, but take care, everyone. And hopefully we'll see you all applying for this opportunity. So thank you. Okay, I think we'll just give it a couple minutes, and then if no one has questions, I know we still have some folks on. There might be some folks away from their computer. I think, yeah, we'll be able to close out in just a minute or so, unless we have other questions. So. All right, that probably wasn't a minute, but I can't wait. I think we're good all. Thanks, everyone.